EECP does a number of dramatic things to the human body. We've seen it be very effective in treating diabetes, Parkinson's, high blood pressure, stroke, and again, just a whole constellation of various illnesses.
In my patients who have gone through Global Cardio Care EECP treatments, they've had various medical problems. Not all have had strokes or cardiovascular conditions, but I've had patients who had diabetes, which we also know is a risk factor for coronary heart disease as well as peripheral vascular disease. And then I see that they have reduced therapy needs for insulin or oral agents if they are taking that for the control of their diabetes mellitus. It's my understanding that that occurs as a result of the increased blood supply that you see, also the weight loss that you see in these individuals who complete the course of EECP.
There are risk factors that we can change, such as high blood pressure, high cholesterol, diabetes, obesity, and stress. These are things that we can improve for a better health. Every single year, Albert comes in and gets 35 hours of EECP. Why? Because it's preventative. Albert has never had bypass surgery. He's not on blood pressure medication. He's not on blood thinner medication. He's not on heart medicine. He's not a diabetic. He exercises every single day, and he's never had to have any surgery.
I had a lot of severe pain in the chest and some difficulty in breathing. And so I would try anything, especially I was interested in alternative, because for me to go into a surgery type thing didn't attract me. And so I felt this was the answer, and I found it to be so. They increased the blood flow to the entire body. It's great not only for people that have heart conditions or preventive heart conditions, it's great for any type of condition that I can think of, because it makes sense. The flow of blood is the key to good life, and that's it.
100% of the people feel better once they get the treatment. And we find that with this improved feeling better, they seem to be able to exercise more, to enjoy life more.
I now play tennis, I play paddle tennis, I go to exercise classes, no lack of breath. I can breathe. People are amazed. They look at me and they say, wait a minute, you got the energy of a 16-year-old, and I do.
My name is Don Murphy, I'm 57 years old.
So my name is Buddy Collette. I'm 84 years old.
My name is Al Weber. I'm 91 years young, not old.
EECP for the last 11 years has been successful in treating people with cardiovascular disease. Unfortunately, the industry uses EECP as last resort. They choose to have people do bypass surgery first, angioplasty second, when all surgical invasive procedures have been utilized and there is nothing else that a physician can use. EECP is being used as last resort.
I have a real good feeling for the director and founder of this clinic, Sarah Salati. She's a dedicated individual who puts a whole heart into this thing. This is not profit motivated. This is motivated by love. And she expresses it with all her people here. It's a very comfortable place to come to. It's wonderful. You feel comfortable. The treatments are wonderful. The results are great.
EECP is FDA approved. You simply lie on a comfortable bed. 3 blood pressure cuffs are placed around your calves, thighs, and buttocks. When your heart is at rest, the cuffs pump oxygenated blood from legs up to the heart. This opens new arteries and it improves total cardiovascular function. Call Global Cardio Care. Schedule a free EECP session today. And after you have the experience, tell your family and friends about the power of EECP. I did.